want to welcome you to this. This is part of a series of fall panels that we've been having celebrating the 125th anniversary of the school. And this one, as part of our Living Our Legacy series, is celebrating women in dentistry. I'm happy to report there's lots of firsts there, some of which I'm sure you'll be talking about. Very pleased that you're able to join us to talk about this tonight and hear about this from this great panel that we have. I don't want to steal too much time because that's going to be way more interesting than much of what I have to say, except to introduce Dr. Prasad, who is our Assistant Dean for Academic Affairs, has been since 2018. She's in the Department of Oral Biology and Diagnostic Sciences, two departments. And she is an oral pathologist trained in New York, also trained at UNC Chapel Hill for original dental school training, and also trained right here at Pitt with an MPH and certificate in leadership and management and health systems. So Joanne's very well suited as a leader in our school for some time to help facilitate this group and have a nice discussion about all that's occurred here and all that we want to see moving forward. So Joanne, enough from me. Please take it away.
Okay, thank you so much, Dr. Costello. And if you all don't mind, I'm going to share my screen for just the beginning introduction and to give people a little bit of a history of women in dentistry. It's going to be really brief and it's not going to capture everything that there, would be to talk about, but just to kind of give people a little bit of a flavor of where we've come from. Okay, so let me do that. First of all, welcome everybody and thank you for joining us. I'm really excited to and honored to be the facilitator for this panel discussion of women in dentistry. And before I introduce our panelists, as I mentioned, I'm going to kind of go over a little bit of a journey down the road of women in dentistry. So the first woman to practice dentistry in the United States was Emeline Roberts-Jones. You can see that she practiced dentistry for a very long period of time, about 60 years. She was never trained or never received a dental degree. So technically she's kind of practicing without a license, but back then that wasn't really something that was available to women. And she learned the trade from her husband, who was a dentist, but had a really long and prolific career, and was named an honorary member of the National Dental Association later on in her life. Dr. Lucy Hobbs Taylor was the first woman in the world to receive a doctorate in dentistry. And she received that from the Ohio College of Dentistry, who had previously refused her admissions a couple of times. A faculty at that school had tutored her or agreed to mentor her to show her skills. So she also kind of practiced without a degree for a little bit of time until they said that women could join the program. And so she graduated in 1866. That's a pretty long time ago. And I love this quote that she's noted to have written, that people were amazed when they learned that a young girl so far forgotten her womanhood as to want to study dentistry. And I love the resolute look on her face. Thank goodness for these women. They paved the way for us. Dr. Ida Gray was the first African-American woman dentist who received a dental degree from the University of Michigan School of Dentistry in 1890. Mary Glenn, so our school, so this is like 1890, so we're kind of like a little bit before we even had a dental school here in Pittsburgh. So we're celebrating our 125th anniversary. That should, if I'm calculating right, about 1896. So about 2 years after the college or the Pittsburgh Dental College opened, a woman matriculated into the program. Her name was Mary Glenn, and that was in 1898. I didn't find a picture of Dr. Glenn. Miss Nora Murray was the first to graduate with a Master of Science in Dentistry. So there was a small graduate program that started some years ago. So she was the first to graduate from that program. And that was in 1935. Dr. Mollie Foster was the first woman that was appointed head of a department here at Pitt Dental Medicine. And she was a faculty here for about 40 years, so a really long period of time. And she was appointed head of the Department of Pediatric Dentistry, back then Department of Periodontics. And you can see her here at the microscope, or I'm sorry, not the microscope, you can tell I'm a pathologist, at a dental chair sitting next to a patient. And this was in 1945. And here she is with Dean Forrest in 1975, receiving an alumni award. The dental assistant hygiene program here at Pitt was established in the early 1960s, and it was established as a combined program early on. So a person could join the program. After a year, would obtain a certificate as a dental assistant. And for those who wanted to continue on to pursue a dental hygiene degree, they could continue on and do so. So the first class to matriculate had about 23 students, 14 of which went on to pursue the hygiene program. And some of the individuals involved early on in the program, Mrs. Virginia McCone and Dr. Helen Morgart, were in charge of running the program at that time. So class composition, where were we back then and now? And back then, I'm kind of not going like all the way back, but I'm going back to some of our panelists' graduation dates. So Dr. Student-Pavlovich graduated with the class of 1980, and there was about 16% women in her class. Dr. Wankiiri-Hale graduated in 2002, and there was about 38% women in her dental class, which is pretty similar to Dr. Snell's, the composition in Dr. Snell's class in 2020. But now that we look at our current first year class that just started in the fall of this year, the class of 2025, there are 56% women, and it's our most diverse class so far in the history of the school. When we look at the dental hygiene program, our current class that just matriculated and started in this fall, the class of 2023, has 2 men in the group. And so that's a 7%. If there's only 27 students, but that's still 7%, which is a little higher than the 5.3% of students enrolled in dental hygiene programs that are men. And that was from the ADIA figure in 2020. And just as a little factoid also, the first man to receive a dental hygiene degree did so in 1965. So now I'm going to introduce our panelists, and I'm really happy to have them here to speak to our group. So first, Miss Helen Hawkey. So Miss Helen Hawkey received an associate degree in dental hygiene from Westmoreland Community College in 2001. And in 2008, she completed a Bachelor of Science degree in dental hygiene with a concentration in health management here at Pitt. Helen worked in a family dental practice for 11 years and has also practiced in a public health clinic. She currently serves as the executive director for the PA Coalition for Oral Health, a statewide coalition working to improve the oral health of Pennsylvanians. Her other leadership roles include serving as chair of the board of the American Network of Oral Health Coalitions, serving on the board of the Pennsylvania Rural Health Association, and in the past, holding various leadership roles with the Pennsylvania Dental Hygienists Association. Helen was a research coordinator for a Pitt-affiliated study on childhood caries, and she has worked as a trainer for oral health programs, such as the Head Start Association program in Pennsylvania and the Pennsylvania Academy of Pediatrics oral health program. Helen resides in southwestern Pennsylvania with her husband and their 2 young daughters. She enjoys spending time with her family and traveling to new places. Dr. Ariel Snell graduated from Pitt Dental Medicine in 2020 as a dual degree student, earning both a DMD and a Master of Public Health degree. Prior to that, she obtained her Bachelor of Science degree in biology from Seton Hall University. While at Pitt, Dr. Snell participated in the Pittsburgh Schweitzer Fellowship Program, where she designed and implemented an adolescent oral health education program in Homewood, Pennsylvania. She is first author of an article published in JADA in 2019, and she has won 4 awards related to her research. Dr. Snell is currently pursuing advanced training in pediatric dentistry at Howard University in Washington, D.C. As a National Health Service Corps scholarship recipient, she plans to work at a federally qualified health center following completion of her program in 2022. She also plans to work on creating community oral health education programs. In her spare time, Dr. Snell enjoys spending time with family and friends, exercising, attending church, trying new foods, and cuddling with her new cats. Dr. Deb Student-Pavlovich received her dental degree from Pitt in 1980, followed by a certificate in pediatric dentistry in 1983. She's a full professor here at Pitt and prior chair of the Department of Pediatric Dentistry, a post that she held for a period of 15 years. She currently serves as interim chair of the department and is also the program director for the Advanced Education Program in Pediatric Dentistry. Dr. Stun-Pavlovich has held several leadership positions in national organizations such as the American Dental Education Association, or ADEA, and the American Academy of Pediatric Dentistry. She has been a consultant for the Commission on Dental Accreditation and for the American Dental Association's National Dental Board Examination and the new Integrated Board Exam. Dr. Stun-Pavlovich has been honored by ADEA as an Enid A. Needle Scholar in Residence, and she's a fellow of Omicron Kappa Upsilon, or KU, the American College of Dentists, the International College of Dentists, and the Pierre Fauchard Academy. Other honors include receiving the Chancellor's Distinguished Teaching Award, a Distinguished Alumna Award from Pitt Dental Medicine, and an Excellence in Education Award from the American Academy of Pediatric Dentistry. She lives with her husband, George, in Oakland. Her hobbies include cycling, walking, and reading, especially historical fiction. And our last panelist is Dr. Christine Wankiiri-Hale. Dr. Wankiiri-Hale earned her DMD degree from Pitt in 2002 and completed an AGD program at Pitt also. She currently serves as Associate Dean for Student Affairs and is an assistant professor in the Department of Comprehensive Care and Restorative Dentistry. Dr. Wankiiri-Hale has served in several leadership roles at our school, including serving as vice chair of the Department of Restorative Dentistry and Comprehensive Care, and as chair and advisor to both the Dental Admissions Committee and the Student Progress Committee. In addition to her administrative duties, Dr. Wankiiri-Hale supervises predoctoral students in the clinic, practices as a dentist in the faculty practice, and is currently course director for several elective courses, including a course on academic leadership. She is also the clinical director of the Academic Career Track Area of Concentration, also called ACT-ARCO program, which is a program for students interested in pursuing a career in academic dentistry. For this program, she is the co-recipient of the prestigious ADEA Guys Award for Innovation. She's a graduate of the ADEA Leadership Institute, of the American Dental Association's Institute for Diversity and Leadership, and of Pitt's Women in Academic Leadership program. She is a fellow of OKU and of the American College of Dentists. Dr. Wankiiri-Hale was a recipient of the Provost Award for Diversity in the Curriculum as well. And when she has some free time, she wanted me to emphasize that, she loves to spend time with her 3 kids and is active in her Northside Pittsburgh community and her church. So welcome to all of our panelists. And we've all kind of had a discussion ahead of time. So I'm going to be referring to them by their first names. So we're going to switch gears a little bit here. So to all of the panelists, tell us a little bit about what were some of the factors that led you to choose a career in dentistry or in dental hygiene. So anybody can go first.
I can go first.
Okay.
I'm Dr. Snell, just in case anyone didn't know Ariel. I always loved dentistry. I always crack people up when I tell them I used to roll a big black computer chair up to my room and force my brothers to be my patients. So I would go and stuff cotton balls and toothpaste in their mouth and do that. And I actually also did do the University of Pittsburgh Health Career Scholars Academy program. And that's where I got to hold my first handpiece and do my first cavity prep. And I was like, this is exactly what I wanted to do.
That's great. So how about our other panelists? What were some of those factors that led you to choose this career?
I'll go next. I originally began my college career with a scholarship to study pharmacy at Butler University. I knew I wanted a career in one of the healthcare fields, and I thought pharmacy might be a good fit. After about 2.5 years into the program, I decided that I couldn't envision myself owning or running a pharmacy because at that time there weren't chain pharmacies. And I wanted something where I was providing a service with a little more interaction. I had some artistic talent, took advanced art classes in high school, won some awards, so played the piano. So I had some manual dexterity that was developed. And my good friend was taking the DAT on a Saturday in the spring, And I was a walk-in candidate. So I can't say that this was something I wanted to do all my life. And the rest is history. Because at the time I applied to dental school, they did not interview candidates. They just reviewed your application and you were either accepted or rejected.
Wow.
Yeah, I signed up for the University of Pittsburgh sight unseen. I had never been in the school.
Wow. That's
Yeah.
very different than how we're doing
Yes.
things today.
And they wouldn't even let you come to talk to anybody. They said, if you get accepted, then you can come to visit the school. And I came over Christmas break to see the school because I wanted to see what I signed up for.
Well, we're glad you came and we're glad you stayed.
Yeah.
So that was amazing. Helen, do you want to go next?
Sure. It's kind of interesting. We saw both sides of the spectrum there already. And to tell you the truth, I grew up as a very nervous dental patient, and didn't really care to go to the dental office. So I actually started my freshman year at Pitt, and planned to pursue either accounting or teaching. And after my first semester, I realized that there were a lot of students in the late 90s thinking along those lines. And I worried that I wasn't going to be able to find a job in Southwestern PA, and that's where I really wanted to be. So I had asked my roommate at the time her opinion, and she said, "Hey, my mom was a dental hygienist. You should do that." And I said, "Okay, that's what I'll do." And she said, it's good hours and decent pay and lots of communication, which you're really good at. And I said, okay. So I changed majors in schools and started down the dental path. And I will say that it really kind of worked in my favor, being a complete dental phobe from the very beginning. That, I was always, it's much easier to build rapport with patients. And I've always been able to empathize with patients that have a lot of dental anxiety. But it's funny because I don't have that legacy history that so many in dentistry come from. And I just kind of happened into the career, but it turned out to be the absolute best thing that ever happened. So it was really great.
That's awesome. And I think Christine is the only one that hasn't kind of shared with us yet. So
sure, yeah. So for me, for those of you who know me, I love working with people, but also, the sciences, and being able to actually pursue a career in hotel management. People who are generally happy, come from different walks of life. They're usually on vacation, so they're having a good time. And so that doesn't include a lot of the sciences. So I was like, all right, how am I going to manage to incorporate this, have a work-life balance, and maybe have to Pitt. So like most something in the health fields, perhaps. And I took a bunch of different courses: philosophy, literature, of course, sculpture.
Christine, you're cutting in and out a little bit. So your screen is freezing a little bit. We caught a little bit of what you said, but not everything.
So maybe if I talk slower, is any better or no? Am I still freezing?
You're okay now. Can give it a go.
All right, give it a go. All right, what did you hear last?
So I heard something about hotel management and then trying different courses like philosophy and some other things. So it sounds like you kind of really had a broad view before you decided to kind of like narrow it to dentistry. Is that?
Indeed.
Okay.
So then to have some kind of a probably more stable dentistry, incorporating arts as well as sciences. Am I good?
So you're still cutting out and we have a hard time hearing you. Do you want to try logging out and
yeah, I may do that.
Try back in. Okay. So,
all right.
And we'll kind of continue, but we'll make sure you're kind of know what the next question, she knows what the next question is because I gave them the questions ahead of time, but okay. So hopefully Christine will be able to kind of like make it back and we'll be able to hear her a little better. So the next question that I had for the panelists is that, so you kind of like decided on dentistry. So did you have any Pitt Dental Medicine mentors or role models, whether, you know, men or women, that was or were particularly influential, helpful, and that impacted either, you know, during your training here at the school or later on in your careers in the dental field? This is for all the panelists.
All right, well, I'm unmuted. I guess I'll go.
Good.
And I just graduated, so I feel like I feel like all my mentors are fresh in my head, and you know, a lot of them are actually on the phone call right now. Dr. Modesto Vieira, Dr. Wankiiri-Hale, most definitely. She was the first person I interviewed with, and I spent many a days in her office just trying to get through dental school. And she also gave me great advice when I graduated and started looking for jobs on how to kind of ease from a student, you know, to a doctor. Dr. Deb, I remember one of the things she told us in class is that she loved watching her patients grow up before her eyes. And I was interested in pediatric dentistry. I didn't know exactly what I wanted to do. But she was always available to answer any questions I had for my research projects in adolescent oral health, and she helped me in my application process for pediatric dental residency. So I'm grateful to her for that. And lastly, Dr. Jacqueline Burgett, I did my research with her. She's a pediatric dentist, active in research and in public health, and that's everything that I am right now. And so she had a huge influence on that. And so, yeah, those are just a few. There's so many other people at Pitt I could go down the list, but we don't have time for that. So I'll just cap it at that one.
Thank you, Ariel, for saying that. The most influential mentor that I had during dental school and during my residency was Dr. Dennis Rinaldi. I became interested in pediatric dentistry because of him. We had pediatric dental preclinic during the first year of dental school and in fall and spring terms. And the first term, my group had an instructor who really wasn't invested in our group or our learning. And so spring term, this new instructor appeared, Dr. Rinaldi, and he spent so much time with us as a group. There were 8 students, and he wanted us to get better. He offered suggestions for improvement. And the other thing was that he was available for us to bring our projects in for evaluating outside of the rotation. He was also the advisor for the student chapter of the American Academy of Pediatric Dentistry, and he invited us to join. And, you know, first year, like when an instructor is inviting you to join a group, you know, you think that was like really important that they were doing that. And so we became involved with the group, and during the residency and subsequent employment at Pitt, I'd have to say that he was the most influential person in encouraging, promoting, and influencing my career path, and I'll always be grateful to him.
I can just share. It's interesting. I have to say that the first person when I think about, you know, mentors from the dental school, really is someone who I didn't meet until years after I graduated, Dr. Deborah Polk, which I'm sure many of you know Deb very well. And, you know, she just has really been influential in shaping the work that I do currently with the State Oral Health Coalition. You know, her passion for improving oral health and studying the barriers to why we can't improve oral health as a non-dental professional, I think is really inspiring, because of course, those of us in the field, we're supposed to care about this. We're supposed to be passionate. It makes sense. And so to see her, you know, she's currently serving as the chair of our board, and her involvement has really helped to demonstrate the importance of that interprofessional collaboration piece, you know, that really is putting dental back into the rest of the health world. And so I think, you know, to see that from her, I just think she's great, and she's so smart. So
that's wonderful. of all the people you guys have mentioned, I know all these people, so it's really nice, and they are all great people. Christine, I see you're back on and you're on your iPhone, so let's give it a try. We're on the question related to did you have any Pitt Dental Medicine mentors or role models that really influenced you either during your training or afterwards in your career?
All right, can you hear me better? Woohoo. All right. So yeah, I would say that. So when I was in dental school and was an undergrad, I had several different jobs, one of which was a career in at the university. And of course, anyone who knows me knows that I don't like the cold weather. So I quickly switched to working in the library. And one of the library liaisons was ended up being my supervisor. And she really sort of influenced me into like thinking about a career in the sciences. She was in the engineering library at Benedum. So it became important for me that as an option. And so I did that. And she actually later became the liaison for the dental school library through the health sciences systems. And so it was really helpful for me to have her. At the same time, I was also shadowing and at the Children's Hospital in the dental clinic. And the lead hygienist, who was also a woman of color, really took me under her wing. And she asked me to think about that as a profession. I ended up in the dental, working with her alongside her. And she had done as a dental hygienist and going into, so she was pretty influential. She later became my wedding planner. So that's a story for another day. And also while I was in dental school, or prior to applying to dental school, I did have a lot of mentors, especially earlier in my career. I went through dental school, and then in my residency, I had the opportunity to come back and teach while in residency, which wasn't something I was at all thinking about. But I had through the resident, especially the faculty and the leadership in the Department of Restorative Dentistry and Comprehensive Care, some of who are here today, were really supportive of different opportunities for me, including the dean, as well as the leadership in the Department of Restorative Dentistry. I won't mention my colleagues because they won't want me to, but they know who they are. Were really influential in opening the door, providing me guidance, and making me think about things that I would if it wasn't for their mentorship. You know, small and big all along the way that really impacted me.
That's great. It's so nice. It's very uplifting to hear all these stories. I love it. Okay, so next question. So as a woman, for all of you, did you experience any personal or familial challenges during your training or your career that was or were related to your gender role? And how did you navigate those challenges or overcome those challenges? So we'll kind of reverse the order. We'll start with Christine this time.
All right, sounds good. So I would say, yes, I did experience a little bit of that. And I think a lot of folks did. For me, particularly in my training, in various parts of my training, it became apparent that sometimes the assistance that you would receive, you know, as a dental student, if you all recall, or even as a hygiene student, you were doing everything by yourself. And so when there was an opportunity to have like assistants or even students who are in assisting school help you, generally it was not uncommon for, as a female provider, for you to not get the assistance, because they usually went to the other, you know, students who were males. And so that was something that was a frequent occurrence for me often. Also, as an, you know, sometimes with instructors, when you're talking to instructors about different careers in dentistry, oftentimes if you'd ask questions about thinking about careers that were perhaps in the surgical specialties or other things like that, oftentimes, you know, you may be advised to pick different careers that might not really involve surgery or things of that nature. So I experienced that a little bit. And then lastly, as a provider, even today, you know, if you get on the wrong side of the chair as a female dentist, you know, you oftentimes sometimes expected to be on the other side of the chair, not necessarily in the provider chair. So those are some of my examples.
Thanks for sharing. Helen, do you want to go next?
Yeah, certainly. You know, I feel like, especially as the dental hygienist on the call here, that's been a field that's been so predominantly female. that it's almost ingrained into all dental professionals. It's just something that we see, we expect. And, I've heard the profession talked about so much as an advantage to women because so many can work part-time and flexible schedules, and we almost sell it like that. So we tell our folks that are thinking about dental careers, that it's an opportunity to still have a family and also do, have a career. And even from the dentist perspective, just numbers wise, our state 2019 licensure data is showing now that nearly 40% of dentists are working part-time. So, we know that as a whole, there's sort of that piece there. We've seen the nursing field shift over the last 20 to 30 years, but dental hygiene just seems to, it's just stuck almost with this female drawl. And even today talking about, oh, there's 2 male students in the dental hygiene class. Wow. It's crazy that we think about it that way, but we do. And, we're starting to see a more balanced dental class come out from a gender standpoint. But even just like 20 years ago, when I started working, most of the employers of dental hygienists were male. And that's what you had. So you have a predominantly male employer with predominantly female employees. And it does seem to create a dynamic. The dentists, and obviously I'm not speaking of all dentists, but it's pretty common that, all of the staff are referred to as the girls. And, patients have adapted that as well. I can't tell you how many times that patients they refer to me as your girl when speaking to the dentist, your girl told me that, your girl mentioned that. And one of the ways that I tried to work to address that is I made it a habit anytime I had a new patient that I went out to the waiting room, I introduced myself, first and last name, said, that I was the dental hygienist, shook hands with the patient and tried to really get them to understand that there was a service there that wasn't necessarily being done by the girl. And, it helped, but I think that we're sort of still stuck there. I don't see that. That hasn't changed. Even in practices where the dentist is a girl, I still feel like we see that with the hygienists and the auxiliary staff.
Yeah, it's pretty surprising also just like how that in that area, in that profession, how it's so, like heavily women who are, going into that profession. And even in nursing, it's not, there's more that are men that are going into nursing these days, but it's still, heavily like a woman or female profession. So that's, yeah, at some point, I don't know. I was kind of excited that there were 2 this year, because usually there's none. So like, this is great, but you're right. It's still very little.
Mm-hmm.
Deb, do you want to go next?
Okay. One time I can remember, this was in first year of dental school. Another female classmate and I experienced a personal challenge. It was with the pediatric dental instructor from the fall term. In our group, there were 8 students, 6 male and 2 female. And before they let you work on Tippet-on teeth, you worked on this stone block. You got the blue plastic cup and you poured it with stone. And then after it's set, you took it out, you flattened it so that and you had a hole in it so it could go on the pole that would go on the dental chair. And then you stamped these designs. They were like butterflies and square boxes, and you practiced on that. And so the first time they had this, what was called the stone block practical, because they weren't competencies in that day. And you had to pass that in order to get on to Tippet-on teeth. So the instructor, began to evaluate our stone blocks, and he went down the aisle in order. And my classmate, the other female in the group, she was in the adjacent cubicle, and he went to her, and her outcome wasn't very good. And as he was entering my cubicle, she kind of peeked her head over the cubicle wall and whispered, "I failed." So he sat down in my chair to evaluate my stone block, and I had a similar outcome. And I'm not saying that I didn't deserve to fail, but it was what he said to me afterwards that I was devastated. It went something like this. He said, "You girls, you're really at a disadvantage." And I was kind of shocked just to hear that. And he said, "You never made model cars or carved wood." He said, "It really would make a difference. Did you ever do anything like that?" And I didn't know what to say. I had this meek voice because I was almost in tears too, because failing this practical. And I replied, "I took piano lessons for 10 years. And his reply was, "That really wouldn't help. Piano playing is gross movement." And I didn't know what to say. I didn't say anything because in those days you did not argue with a professor or an instructor. Unfortunately, though, that was a very isolated incident, and I was fortunate for so many good instructors like Dr. Long, Dr. Hinkleman, Dr. Rinaldi, that this incident did not deter me from pursuing a dental career. But I still remember it, and it's been 45 years.
Ariel?
Okay, so I'm next. For me, what usually happens, and I'm gonna echo what Dr. Wankiiri-Hale already said, is that I get all the time, "Are you the hygienist? Are you here to, like, where's the dentist?" And so at that point, I kind of just, what I do is I continue on. I say, "No, I'm Dr. Snell. I'm here to, take care of your child, to take care of the patient." And then, I sort of continue with the exam and the treatment and sort of prove to them that I'm the the one with the dental degree. And usually it works out pretty well. In my experience working with kids, they usually already see me as an adult. And so hasn't been as much of an issue. It's usually with the parents that they're like, "Boy," it's not necessarily that I'm a woman, but "Boy, you're young," type of thing. And, then on top of that, me being a woman too, they're like, "Where's the dentist? They think I'm the hygienist." So I just kind of like put a smile on my face and deal with it that way.
So the next question I'm going to ask is mainly for Deb and Ariel, because you're kind of the two spectrum on the panel. So do you think that these types of challenges are less or more prevalent today than in the past, or the same?
Oh, I think they're far less prevalent because I think people are more aware of offending people by making these kind of, I would say, crass comments. My incident, like I said, happened 45 years ago, and that's quite a long time ago. So I think by just having so many females in the current classes in the past decade, and having female dentists that have been successful, because the other thing that was kind of mentioned in dental school, like they never thought we were going to practice dentistry full time, like we were wasting a spot. That was said a couple times, like, "Oh, you women you're here to get a Mrs. degree." Yeah, those kind of comments were made. And I think that because we're, entering the workforce and working hard and diligently, that I probably think it's forced change a lot. I definitely don't think those kind of comments are being made now. Maybe I'm naive, but I don't think so.
Yeah, I would have to agree. I'd say that they are less prevalent, but this hasn't happened to me personally, but I do know some of my female classmates who have been sort of confronted with positions with supervisors who have sort of been not as inclined to hire females, especially unmarried or newly married females, for fear that they would get married and then want to take off for maternity leave. And so that's, to be honest with you, that's one of my fears, as far as being discriminated against for being an unmarried single female who does eventually want a family one day, and then, you know, being discriminated against for wanting that and having to take maternity leave because of that. But yeah, so that, I think that, you know, just to echo off what Dr. Deb said, it's not as you know, prevalent as it once was, you know, in the past, but now I feel like it still exists, but just not as much. And also it is really great that there are so many other female dentists out there and dental hygienists out there who can become mentors for, you know, young dentists like me to help us sort of navigate those processes.
I'm hopeful that maybe these types of barriers and challenges will keep diminishing. So hopefully we're headed in the right direction, but we still have, looks like there's still some room to grow there. The next question is for Christine. And although it can certainly happen to both men and women, I think women are more frequently subjected to inappropriate comments or even advances, sometimes from patients, sometimes from other members of the healthcare team. So can you tell us about the program at Pitt, that your program called When the Appointment is No Longer About Dentistry, how that program came to be and how it's helped our students respond to these types of aggressions?
All right, let's give it a try. So tell me if I'm glitching, and maybe I should turn off my camera. So.
So you were kind of cutting off just a little bit.
All right, my camera, and see if that makes a difference. And so is this any better?
We can hear you.
All right, so pause or somebody say something if I am totally glitching, because then I'll try. So I think at the school, so one of the things we've tried to do program as for training dentists, you know, future dentists, and it's called I do that in conjunction with my colleague, Dr. Shuja Horvath. So one of the goals of this program is to try to create potential future dental educators who create inclusive patients and colleagues.
Oh, we're losing you, Christine.
All right. Well, I can put it in the chat. I can put the program in.
Okay, maybe I think that's not necessarily a bad idea, just so people can know a little bit about that program, which is really a great thing that that I think you guys developed. So I'm, you know, really kind of something for us to be proud of. There was also an anonymous comment in the chat about something that happened just here apparently at the school yesterday, but where a patient didn't like that the provider was a female resident and with a female attending faculty. And as soon as a male dentist came to the clinic, the patient was all of a sudden kind of had a very different attitude and was very pleasant to the male provider. So that's kind of a bit of a sad story, but I know it still happens. So while we'll allow Christine to kind of type up her answer there, and I'm sorry that we're having some minor technical issues there, but we'll kind of in the meantime move on to the next question. And I'll go to the question for Ariel and Helen, who are both involved in public health efforts. So I think in general that women have really played a proactive role in dental public health efforts. And you're both great examples of public health advocates. You've done a lot of work in that area. So can you tell us what led you to become such strong advocates for oral health at the population level? And also, how can we encourage more dental professionals to become involved in population health? So I'll start with Helen.
Thank you. I think that for me, one of the things that really opened my eyes, working in my background with the Dental Hygiene Association at the state level, I started to do some government relations work with the committee. Started, doing some traveling with the lobbyists of that organization and meeting with different legislators, and really started to see that. We have a strong need for better data in our state. So our data are lacking in a lot of ways. And, my motto is, if we don't have the data, it didn't happen. That's just, the way that it works. And so I think that for me, knowing that in order to be a good advocate and to get people to sit up and pay attention to what was happening in our state, we had to first go and find data. And once we found those data, then we had to go and take that back and start to sort of see how the system works. So often, and I think coming from clinical practice, we think about individual health so much. I mean, we're taught that you write a treatment plan for an individual patient, that you're only trying to do what's the very best for that patient. And from a public health model, that's not what we're trying to do. We're trying to do the most good for the most people. And sometimes that's not what's best for an individual patient. So, finding that blend of how we meet the data that we need to advocate for the policy that we want, in a way that serves the greater population, has just become such a passion of mine, because I know we can make real change. And I've seen things, small policy changes that have had some pretty big effects. And so when I talk to dental students and dental hygiene students about this, one of the things that I talk to them about is, of course, pointing out those differences between population health and individual health, but also really encouraging them to truly think about themselves as healthcare providers. Our kind of old standard was that dentists really came out of school looking at small business ownership as sort of their prime responsibility. We were raising small business owners and not healthcare providers. So, and I was just at the school last week or the week before, and the class that I spoke with were really, really focused on that healthcare provider piece. And so I think that's really, if we think about it from that perspective, you're just a natural advocate then, right? So you're just automatically going out there and you're speaking what's best for the patient from a health perspective, and taking the business of dentistry maybe a little bit out of the business of dentistry. So that's where I think we really need to put our focus.
Yeah, I totally agree. One of the things that I would say is that my, I think, passion for population or community health comes from, I think, a compilation of experiences that happened with individual people and interactions that have happened in my community that I've seen occur over and over and over again. And then you realize it's not just this one person that doesn't understand how many times a day you're supposed to brush your teeth. It's not just this one person that has a fatalistic mindset when it comes to oral health, that it's actually on a bigger scale than that. And so for me, I think it's just from being able to work with people and see their stories and being able to understand and grasp what the main problems are, that I'm able to, that I sort of develop that passion. But the thing is, for me personally, I didn't know that I really cared about public health until I actually got into dental school. I always was passionate about the community. I did a whole lot of community service programs. I dressed up like the Tooth Fairy doing oral health education projects for kindergartners, all the way up till, I got to dental school, and then did an adolescent oral health education program. So I've always been, working with kids, and I'm realizing that this was me doing my part to help communities, and not only to help them, but to, increase oral health education within those communities, and then to create programs to decrease the barriers to dental care for those specific communities. And you know, in that process, in that process, I'm grateful to University of Pittsburgh for offering the DMD MPH program, because it gave me an opportunity to tap into something that I've always loved. And for me, it's going to help a whole lot more, especially as a National Health Service Corps scholar, because I will be working in underserved communities where I can create programs and institute activities and different things to sort of help communities to overcome those barriers to oral health. So it's something that I'm excited on. And I think that by continuing to make, you know, like the programs like the dual degree program available to other students like me, then, you know, you give us an opportunity to help other people.
Well, thank you so much to both of you, because we need more like that. And you do great work, and it's so valuable and meaningful. So, you know, I just wanted to say that. So it looks like, I'm told Christine sent me a little direct message that she's on her phone now. So she's going to try to kind of answer the last question related to the when the appointment is no longer about dentistry. So we might not have quite as much time, Christine, but if you can kind of like give us a quick summary of the program and how that's helped students respond to microaggressions or more significant aggressions in a dental setting.
Absolutely. Can you all hear me now?
Yes.
Woohoo! Finally. Sorry all for all of my technical difficulties. I've been on Zoom all day. You'd think that it would behave, but oh well, here we are. So just a quick summary of the program. So when we you know, talked with a bunch of students, we found that sometimes they have some difficulties or struggles when they adapt to moving into the clinic. And so one of the things that we did with my colleague and I is created a session for first-year students. And the biggest issue for them is whether they you know, respond to inappropriate patient behavior when they're coming into the clinic. Now this particular module that we came up with is called When the Appointment is No Longer About Dentistry, because, you know, the appointment ceases to be about dentistry. And so one of the biggest things is that the students are often caught off guard when remarks are made to them, whether it's, you know, macro or microaggressions, maybe the refusal of the patient to have care or question the provider's role. Sometimes it's verbal or nonverbal disrespect. And oftentimes they don't know what to do about that. And so one of our students who was in this academic career training program brought it to our attention and said, you know, she had an incident when she was in school, and she wanted to use that to help her peers to be able to manage these types of situations that happen within the dental school. And so we recognized that there was a need for training and introduced this content to first-year students. And the best opportunity for us was to allow the students as peers to provide this training to underclass students. So in the first year, before the students enter the clinic formally, we have them be taught by some of these senior dental students who show some short video vignettes of inappropriate behavior situations that actually happen to them. And then during class, the students will discuss this with their classmates and peers about how would they respond if this happened to them, especially because it happened within our dental school. So it's not something that's out of the realm of possibility. So the example of the one student who brought up this whole module was the patient approached her at the end of the appointment, kissed her hand. And so then we sort of freeze this clip and show this, ask the students, what would you do in this situation? And so we have multiple different sessions like this of different video examples over the years that students have recorded for us. And we show this in the first year so that they can really get a sense of how to manage this curricular content. So that's what we did. Thanks.
I think that's such a good idea because, you know, to think about it ahead of time, how would I respond in that situation helps you prepare, because there's probably a pretty high likelihood that it's going to happen at some point. I think most female providers have probably experienced some similar issues at some point, or might at some point if they have not yet. So we just have a few minutes left. So maybe just quickly, I just wanted to ask our panelists if they have any words of advice for young women entering a career in dentistry, dental hygiene, or a specialty field within dental medicine.
I really think that dentistry has been an excellent career for me. I enjoyed pediatric dentistry because it's proactive and preventive based. And I remember one day I was grumbling about going to work and I didn't want to get out of bed. And my husband, who's an engineer, said to me, "Deb, you have such a great career. Every day you go to work and you have an opportunity to help someone directly and immediately. And it might be the filling that you do, it may be talking to the parent or just being there for the patient." And, I thought about what he said, and I think it's really true. And I think that that is inspiring to people because you do have a chance to help somebody and make a difference in their life. And it's not always about the dentistry either. So that's been very rewarding to me, but I never thought about it in those terms until my husband told me that.
That's really nice. I like that. Helen, do you want to go next?
Sure. Yeah. I would just say being confident in your skills, because sometimes it is hard as a female provider to just know that you know what you're doing. And I think that every member of the dental team plays their own role in patient care, and it doesn't work without all of them. So I think that's something that's really important. And I love what Dr. Deb said about that piece. There were many times where I did not accomplish anything that I wanted to do in an appointment because we were crying or talking, or you just have no idea the role that you can play in someone's life. And dentistry is just a great way to do that. So.
Okay, thank you for sharing that with us. Ariel, do you want to go next?
Yes. So my advice for anyone who's entering the field of dentistry is that so far, I think it's a wonderful field. I think, 1 year I'm out of school in residency, so I haven't quite experienced all that life has to offer outside of the school environment. But what I can say is that it has given me an opportunity to help others, has given me an opportunity to make an impact on my community, and it's fulfilling. And so to anyone who's out there who's considering, I would say that it's definitely something that you should pursue. It's going to be hard for anyone who's just coming out of school. You don't forget how difficult it is. So I would tell them just to keep pushing, keep pulling through, and that there's a light at the end of the tunnel.
That's good advice. And Christine.
Sure. Yeah. Just quickly, I'll say that, always consider anyone you interact with as a possible mentor, maybe a future colleague, also a friend, and seek out those mentors. Don't wait for them to come to you. Folks are usually really interested in trying to help you succeed as well. So, be willing to do that. I'll steal Marnie Oakley's words, never say never about possibilities, and, being open to things that you may not have ever thought about doing. And if you're a little bit uncomfortable about doing it, it's probably a good idea to do it because you're going to end up being so much more fulfilled in what you do. So, of course, work-life balance is always important to me as well. And for the dental students out there, I just would put a reminder out there that dental school is not your dental career. It's dental school. So they're not the same thing. So don't be discouraged. So that's what I'll say.
So I think we're out of time. We ran a minute over. I want to thank the panelists so much for some great insight, great stories, and thank you for sharing with all of us. And thanks to everyone who took some time out of their Tuesday night to join the panel and hear what we had to say. So thank you so much and have a good night, everybody.